Dear colleagues, this is the MRI brain of a middle-aged patient who presented with complaint of headache. These are the T2-weighted images, and here we can see there is a small, well-defined hypointense lesion in trigone of right lateral ventricle with adjacent periventricular edema. This is the T1 weighted sequence, and the lesion is showing isointense signals as compared to gray matter. This is the DWI sequence, and the lesion is not showing any hyperintensity. This is the ADC sequence, and the lesion is not showing any corresponding hypointensity. This is the SWI sequence, and the lesion is not showing any significant signal dropout. These are the post-contrast images, and here we can see the lesion is showing intense homogeneous post-contrast enhancement. So these are the typical imaging appearances of intraventricular trigonal meningioma. Primary intraventricular meningiomas are very rare. Most intraventricular meningiomas originate in the trigones of the lateral ventricles, and the left lateral ventricle is relatively more frequently affected than the right. Less commonly, they may arise at the foramen of Monro within the third ventricle, or very rarely in the fourth ventricle. Trigonal meningiomas are believed to arise from the infoldings of the meningeal tissues during the formation of the choroid plexus. Most of them occur in patients above 30 years, and females are more frequently affected. Intraventricular meningiomas present usually due to mass effect, either by direct compression of the adjacent brain or from obstruction to normal CSF drainage with resultant hydrocephalus. MRI is the imaging modality of choice, and they classically appear as hypo to isointense when compared to gray matter on T1 and T2 weighted sequences, and show intense homogeneous post-contrast enhancement, as we have seen in the case. The differential diagnosis of the enhancing lesion at trigone may include choroid plexus papilloma or carcinoma, but they are mostly lobulated and are common in children, while meningiomas are more common in adults. Surgical excision is the treatment of choice. Thank you.